Hello everyone, welcome back to Nursing with Benoni, where we put the page into practice. I'm Nurse May, and today we're going to do another video request about progress notes. Nessa has requested a progress notes video about new medication orders and antibiotics. So we're going to talk about that today. Before I get started, please make sure you subscribe and hit that bell so you can be notified when we put our videos up. That would be greatly appreciated. And now we're going to get into progress notes. So, for example, you get a patient, they're nauseous, they feel like they're going to throw up, which I guess is what nauseous means. So you call the doc, you get an order, and this is what the note can read. Patient has a complaint of nausea today. No emesis noted. Patient does not have signs of constipation. Bowel sounds present in all quadrants. Abdomen soft, non-distended. No pain present upon palpation. Doctor notified. New order received for ondansetron 4 milligrams, Q6 hours PRN for 2 days. Family and patient notified. You want to always do a little bit of an assessment before you go and just talk to the doc. So, what are some reasons for nausea? Someone could be quite constipated, maybe have an ileus. Somebody could maybe have, a virus or something. When somebody complains of nausea, it's always a good idea to do a quick rundown. Maybe check their blood sugar if they're diabetic, do a quick GI assessment, and then you have something to give the doctor when you ask for it. Instead of just saying, they're nauseous, can I have ondansetron? So you give them a little assessment, and you always want to include that in your progress note. Then you go ahead and give them the medication, and then you also need to document a follow-up progress note. So, PRN administration of ondansetron effective, patient denies nausea, vomiting, done. All right, now we're going to talk about a new order for an antibiotic. So, say you have a patient, they have burning, frequency of urination, what are you going to do about it? So, this is what you can do. You're gonna call the doctor. They'll probably tell you to get a UA and maybe even start a antibiotic until the results of that UA come back, because a culture can take about 72 hours to identify which organisms are there, because it has to grow and so forth, and then they print out culture insensitivity, which tells you the bacteria and which medications will kill it, basically. So this is what your progress note can say. MD notified, new order to obtain UA in PO Bactrim DS 160/800 milligrams BID for 14 days. Patient and family notified. So what you did is you gave them the Bactrim, la-di-da, and now you also need to write a follow-up progress note. It's good practice to write a progress note for every shift whenever a patient is on an antibiotic. So you're monitoring the fact that they're on an antibiotic, what effect is it having, etc. This is an example of a progress note you would write for a patient currently taking an antibiotic. Okay, so you write, patient continues on Bactrim DS for treatment of UTI. No adverse effects noted. Patient denies dysuria and confusion has decreased. Patient is returning to baseline cognition. That's it. This tells you they're still taking the Bactrim, they don't have any reactions to it, and they're getting better. Thank you so much for watching. If you guys have any questions or comments or additional video requests, let us know. Stay tuned for the next video where we continue to put the page into practice.